Hello, I'm Mariette DiChristina. I'm the Dean of Boston University's College of Communication. I'm also an alum of COM, where I was first inspired to pursue journalism myself and parent of a recent BU grad. Welcome to today's event, How Should the Media Cover Gun Violence? This event is being recorded and will be available later both through COM's website and through its YouTube channel. Many experts agree that gun violence in the United States is a national public health crisis, but mainstream media coverage often failed to provide a nuanced and contextualized picture of the situation. Today's panel will explore the current state of gun violence in the US, the pitfalls of focusing on the only one type of tragedy, and what specifically the media should do in order to report on gun violence in a more ethical, impactful, and constructive way. We'll have time for questions a bit later, and when we do, I hope you'll please put them in the Q&A box at the bottom of your screen rather than in the chat, and feel free to put those questions in at any time. Now it's my pleasure to introduce each of our speakers and then our moderator. First, I'd like to welcome Naseem Miller. Naseem is the senior health reporter at the Journalist Resource, covering health and medicine with a focus on disparities, as well as the intersection of journalism and trauma. She previously reported for the Orlando Sentinel, where she covered the Pulse nightclub mass shooting and was part of the team that was a 2016 Pulitzer finalist for its coverage of the tragedy that took 49 innocent lives. In 2017, she co-started the Journalists Covering Trauma Facebook group as a gathering place and an information resource on covering trauma and journalists' mental health. Welcome to you, Naseem. Thanks so much for joining us. Now let's welcome Eleanor Kaufman, who is Assistant Professor of Surgery in the Division of Traumatology, Surgical Critical Care, and Emergency Surgery at the University of Pennsylvania. She completed a fellowship in trauma surgery and surgical critical care here at Penn, and joined the faculty in 2020. Her research focuses on reducing the harmful effects of traumatic injuries on individuals and communities. Dr. Kaufman studies both injury prevention and the role of clinical care in patients' physical and psychosocial recovery from injury. She holds an MD from Harvard Medical School and an MSHP from the University of Pennsylvania. And she serves as medical director of the new Penn Trauma Violence Intervention Program. Welcome to you, Eleanor. Now I'd like to welcome Abené Clayton. Abené is a reporter and video producer based in San Francisco. She graduated from the Berkeley Graduate School of Journalism in May 2019, where she produced 2 news magazine length videos. The first focused on disparities among Bay Area kidney patients, and the other looked at crime survivors in Richmond, California. She's currently part of the Guardian newspaper's Guns and Lies series and specializes in covering community-based gun violence and California's criminal legal system. Thanks for joining us today, Abney. Now let me welcome our moderator, after which I'll turn over the virtual mic. Sarah Kess teaches trauma journalism here at Boston University's College of Communication, in addition to working as assistant director of the Power of Narrative Conference and as the College of Communications meeting and events coordinator. She previously was editor with the Upward Society for Trauma Journalism. Thank you for joining us too, Sarah, and now over to you.
Thank you so much, Mariette. Thank you so much to Eleanor, Abené, and Naseem for being here this afternoon. We really appreciate your perspectives and can't wait to hear your thoughts on what we're talking about today, which is how the media reports on gun violence, especially what we get wrong and how we can do better. So Dr. Kaufman, I'd like to start with you because in 2020, you led a study which examined the way the media covers shootings. And in short, you found that the media's reporting on gun violence often does not reflect reality. Can you briefly give us some of the key findings from your study?
Thank you so much. And thank you so much for putting this panel together and for having me here to be part of it. I am by no means a journalist, but I'm not just, it's not just flattery when I say that I think what you all do really matters a lot. And I hope that that's why you do it. Because I don't know, I mean, gun violence is an emergency. It's been at emergency levels for years in this country. We are completely out of step with the rest of the world. And we are losing young people, and predominantly, we are losing young people, predominantly young people of color. We are losing lives every day, every hour, in this country. And yet we as a nation in some way don't seem to care. And I think we have to believe that the way that the media covers this issue or any issue is going to have a pretty big impact, right, on what people care about. And for me, I think we need some pretty big changes, and we need the political will and the social will to make those changes. And if people don't understand the issues, and if people don't care about the issues, and if people don't care about the people who are directly affected by the issues, we're never going to get that political will. So I think there's a huge opportunity, and I'm so excited that your attention is on this issue. I'm really, it's hard to maintain optimism, but as we were just talking about before the panel, there is, I think, a real building of interest happening right now, and I think there's a lot of opportunity. None of that is what you asked, but I worked with colleagues on the study that you talk about, looking at how often, just counting really, how often people injured by shootings, community violence, interpersonal violence, were reported in the news media at all. And I, as a clinician taking care of injured people, I do sometimes look, like, Google them the next day, or look in my local newspaper or my local television news to learn more. I don't know. It's there's something very disorienting about having these terrible events happen that we're taking care of and then seeing nothing. But there's also something quite disorienting about the way that the coverage is. And oftentimes I don't know the circumstances. Maybe I'm curious about the circumstances. Maybe I want to know what else happened out in the community where a person was injured, and I'll look it up. And I don't always find anything. And it does feel really strange. So we got the idea to work on this study in that way. It's really hard to find out how many people were shot. This is a basic piece of data that we as a country don't have, and that's something that I can go on and on about. But I won't right now. I will just say that we had good incident level data that is publicly available from police departments in 3 cities. So we looked at Philadelphia, where I live and work, the city of Rochester, New York, and Cincinnati, Ohio, which all provide information about how many people were shot. And that's what we needed to be able to then look for news reports and say, of those folks who were shot, how many of them were reported in one way or another. And overall, we found that about half of the people, about 51%, were in the news at all. So half of people who were shot, there was no coverage that we could find. And we drew all the coverage from the Gun Violence Archive, which is a group of people that work really hard to collate all that. So we found that the news was missing about half the people. And so that means at the most basic level that the public has only half an awareness of what's going on. Right? And it wasn't evenly distributed. So, you all tell me if I'm wrong in this characterization, but I think that events seem more newsworthy when they're a little bit more severe or when they're a little bit more unusual. And so fatal shootings were much more likely to be reported. Multiple shootings were much more likely to be reported. And shootings that happened in cities where there were fewer shootings were more likely to be reported. And on any given day, the more shootings there were, the more likely you would get at least something reported. But if you as an individual were shot on a day when a lot of other people were shot, you were less likely as an individual to make the news. And so what I take away from this study, is that we're missing a big part of the picture, just numerically, just in terms of the basic level of the impact of this epidemic. And that not only are we missing half, but we're not missing a random half. We're distorting our understanding, of what's going on.
Thank you for that perspective. It's really interesting to have the perspective of someone who is a clinician, and how we can kind of take that and learn from that in journalism. I want to ask kind of the same question to Abené. I know the series that you write for is called Guns and Lies. I'm imagining you have something to add about where you kind of feel the media is failing in our coverage of gun violence.
Yeah, so the project was started by my colleague Lois Beckett, who did gun violence coverage for ProPublica before coming to The Guardian. And by the time I got on, personally, where I was as like a journalism student and reporter in my local community of Richmond, California, was I got to see the national news coverage of gun violence really begin to center almost exclusively on high profile mass shootings. And I always make that distinction between high profile mass shootings and just like mass shootings, because I go by a kind of numerical baseline rather than all of these kind of qualifications of, motivation, location, and all of those things that just lead to like, kind of racist dismissal of mass shootings that happen all over the place. So having that context and then being able to watch more news, learn more about journalism, and find that there's really no reason besides the issues that Eleanor mentioned being overlooked. Like there was no reason why the conversation on journalism couldn't be about all the forms that it takes. The conversation on gun violence couldn't be about all the forms it took, and not just on high profile mass shootings, which ended up being the main drivers of a lot of legislation proposals and an entire like national gun violence prevention movement, frankly. So I was seeing all that happen. And at the same time, talking to the people in my community that I had seen since I was just going to community events, who would stand out there with signs about their loved ones who were killed in 2001. And now we're in 2019 and there are still no answers, no attention, none of the after school programs they've been asking for, none of the preventative measures these families have been calling for happened, and they weren't being covered in the local news. At least in the local news, I would find out that there was a shooting, where it happened. I would have to rely on community context to get, maybe the name and find out if the family members were being helped by any organizations or individuals. But at least I was able to see it. But then my kind of concern there was that there was no follow-up and there was no inclusion of the people who have been working in communities out of their own pockets, usually without much support. Like maybe you'll get like a plaque or a certificate from, the county to be like, we recognize what you're doing, but still there was no funding for these people who show up to board meetings, who show up to, school board meetings to say like, hey, we need to do everything we can to approach gun violence from every single angle. Those stories just weren't being told, and therefore they weren't informing the larger conversations we were having. So I came onto the Gun Violence Project because that was already my perspective. It was just work that I felt needed to be done, and that I thankfully had the trust of the community in Richmond and in Oakland and throughout the Bay Area to do. So I feel like some of those gaps persist. I've seen lately with some of the more recent, unfortunately, high profile mass shootings, there's like I see high profile mass shooting coverage as like a clock that unfortunately follows a pattern that if you've been in journalism or just watching long enough, like, what it looks like, when it's that 6 o'clock, 9 o'clock hour and stuff. And I feel like around what I call like 11:30, right before the clock resets, there's like a little bit of time for people to say like, don't forget the main forms of gun deaths come from suicides and community violence. And then unfortunately, the clock begins again. So I'll say that's progress, because before it was illuminating to people to even tell them that the majority of the US's gun violence burden is not high profile mass shootings. That was a shock to some people. And the fact that we aren't there anymore is good, but we still, I don't think, talk enough about what people have been doing where they live to address this, and what it says about, systems accountability and, where we put our priorities, being data driven, and all these sort of things exist in those stories. And unfortunately, we as an industry keep missing out on it for a bevy of reasons that, I hope we can talk about. And I'd love to hear Nasim and Eleanor's perspectives on what's missing as well.
Yeah, I'd love to kind of expand. There's a lot of really important points in there that I'd love to expand on. And Naseem, I'd love to get your perspective on first, is there anything that you want to add to this conversation about what is missing in coverage? But also, gun violence is often reported on as a crime problem rather than a public health issue, even though experts agree that's exactly the wrong way to report on gun violence. And I'm hoping you can talk a little bit about what it means to approach reporting on gun violence from a public health perspective.
Sure. Well, thanks so much for having me. Yeah, I mean, I agree with everything that Dr. Kaufman and Abené said. Again, these are lessons that we learn in journalism, and a lot of times context is key. So I really think it's important for us when we are reporting on gun violence to put everything in context and also look at research, talk to academics. So when people say whatever area or trend that they cite, ask for studies that back whatever information they're giving you, or look for studies that back it or refute it. So in that way, you can add more body and inform your audiences better. And the other thing I think we should do more of is add solutions, whether it's at the community level or at the state level, wherever it is, look for what's working, because not only it gives hope to your readers that there is a way to fix things and there are options out there, but also as a reporter, it gives you a little bit of hope, and it's a positive thing in your story, and it's good for your own emotional health, that it's not all doom and gloom as much as sometimes it feels like it. So look for solutions as much as you can, especially when you're talking to sources. And, there's no one single solution for this complex problem, but at least if you can highlight one piece of it, it would be great. As far as the public health angle of gun violence, I mean, just, I've been a health reporter for all of my career. So a lot, I mostly covered, hospitals and health insurance and things like that. And one of my main brushes with this issue was a high profile mass shooting, which was in Orlando. But since I was a health reporter, I was mostly talking to physicians and our medical examiner. And that's how I started talking to trauma surgeons. And I really recommend you guys get to know one or two trauma surgeons in your local hospitals who actually see what is happening in the community. Aside from these high profile events they see day to day, pediatric surgeons, speak with them, see what they see in the pediatric unit and what's coming in. And they can really illuminate this. And a lot of like the folks I talked to in Orlando are very passionate about this issue. And, one of them, when I was talking to, he said, there's a disconnect between what we know as physicians and what the public knows. And that's what this, I think, disparity exists between the public's understanding of the issue and the fact that this is a public health problem. And really, one of the things he mentioned is gun violence is one of the top causes of death in the US. There was a new report out of the Kaiser Family Foundation where it says firearms are now the #1 cause of death for children in the US. So these are statistics and numbers that you can add to your stories to show why this is a public health issue, because we would pay attention to number of deaths if it was because of cancer, heart disease, stroke, and guns also are a cause of death here. Talk about how much research is being done about this. There's been lack of funding for research for years because of this thing called the Dickey Amendment. And since then, since 2019, there's been some more funding, and it's, about 25 million, which is not a whole lot, but it's split between the CDC and NIH. So thankfully, we are seeing more studies being done. So try to find those researchers, see what kind of studies they're working on, what issues they're working on. And at the same time, add the context that there is a lot that we still don't know because of the lack of research, because of lack of data and databases that collect all this information about what's happening locally. As this physician, one of the physicians I was talking to, he said, we know everything about every single accident that happens in the US because it all gets recorded. There's a database for it, like car accidents. But we don't have a database like that for guns and gun violence, whether they're fatal or non-fatal. And along the same lines, there are studies that show you that non-fatal firearm injuries are expensive. They cost money, especially for survivors and for us as a whole. So the medical spending increases by thousands of dollars for people who survive gun injuries. Again, that's another health and public health angle of this issue. There is, the emergency department visits and inpatient admissions related to firearm injuries are about $3 billion a year. So that's not a small number. So remember that. And also remember the mental health angle of the issue. The communities who are facing gun violence, the children who witness this takes a huge toll on those parents, on the children. So don't forget the impact of these gun violence on people who witnessed it and are around it.
This is kind of making me think about, in communications theory, we have what's known as episodically framed stories, meaning stories that cover specific events and individuals versus these thematically themed stories, which look much more broadly at gun violence. And what you're describing sounds like very thematic types of reporting on this sort of broader issue of gun violence. And I'm curious what concretely that looks like when you are setting out to do stories with a broader framework, how that reporting process might change when you're not just covering a single episode, but you're actually trying to look at this kind of root issue of gun violence. I guess I would start with Abené, because I feel like your work does this really frequently. Could you talk a little bit about how your reporting process works when you're trying to get at this gun violence as sort of a broader issue?
Yeah, so one thing that I feel like I'm very fortunate in my role as a reporter to have is I have a lot of I have the luxury of time. Often my editors understand that to do this well, sometimes it might take a couple weeks of reporting, right? Like you might be doing a ride along that goes from like 7 p.m. to midnight, and like you gotta, file some overtime. And so I'm able to do those things. And a lot of the stories we do, another kind of good thing about the role is that it's not like I don't have to be obliged to like news pegs, you know what I mean? Like everything I don't have to pitch something that's like, I want to do something on how many people are getting, victims compensation. Who are these, what's the racial breakdown? Does it match what I'm seeing in the, in the state in terms of gunshot wound victims and, survivors and people who have been unfortunately killed? And I get to just kind of ask that question, and my editors are like, go find out, and it's a very evergreen type of story. So there are times where something will happen in the news cycle. There would be perhaps a big piece of legislation, a spate of shootings, a update in a case, with a homicide victim that I had been talking about previously, and I have to jump on that immediately, but I'm able to bring up topics and just things that I've been hearing about for a while. Like if community members have for a while been saying, when I lose a loved one to gun violence, unfortunately, I talk to a lot of moms, who have lost their sons to gun violence, and they all have these really adverse health consequences after. These women are unable to work a lot of times. I know so many who are like, yeah, I can't drive anymore. I'm sorry, I laugh because it makes me sad. I'm not gonna start like crying during a panel, because these stories, like it just brings back so many emotions. But like, they'll be trying to drive and it's like, I lose sight in one eye. I'm on heart medication now that makes it to where I can't go pick up my kid. I don't want my children to see me like this, and all of these things. And I asked them like, well, who's paying the bills? Like if you can't work, and a lot of these women are in, civil service type jobs, and the bereavement time, if there is any, might be 3 days, when you're dealing with this sort of traumatic experience, especially if it happens in your own community. 3 days off work and no conversation or ongoing support after is not going to get the job done, and that perpetuates a cycle of violence in a way that I don't think a lot of people understand, because then her children then see that, and they don't have the support. They feel like they, have all of this on their shoulders. And I just think that is a dynamic that happens so often, and it can be talked about at any time, you know? And I think that those things that I hear about so often, but I'm like, okay, I don't know if that's for this story. Like I can always save that for a larger one, you know? A big thing is always unsolved homicides. You know, I talked to people who lost a loved one in 2017 and they're like, I don't know anything. No detectives have gotten in touch with me. And I think explaining those processes is something that is always on the table to do, and is a great public service, you know, for people to understand how seldom these sort of crimes and these sort of incidents, and, you know, how seldom people are sometimes held accountable or people get answers, is something that is always worth, you know, covering and talking about, I think. So when it comes to my process, early on, it was a lot of like, sorry about my Slack, but early on, it was a lot of conversation about, you know, how do we talk about the decrease in gun violence, you know, that was happening at the time. And now it's become more like, how do we approach and talk about this unprecedented interest at the federal level for gun violence prevention and community violence prevention. So it's evolved quite a bit, but it is seldom dependent on episodes. Or if it is, you know, if the impetus for a story is something like a high profile mass shooting, we're always able to expand it, take our time, talk about, you know, all of the context, and kind of go from there in a way that I understand a lot of like local reporters, people who are on tighter deadlines with more stringent assignments, can't always do, you know. So I always like to give other reporters, especially the ones who are trying to do better, a lot of grace, because I'm able to do this and take this time and do evergreen stories and have like a queue of stories that, you know, I can write at any time because of my newsroom leadership, you know, because they give me that space. So I always like to add that caveat that like, yeah, this is the best practice, but that's because thankfully, you know, my editor at The Guardian has cultivated it that way, to where I can come up with an idea and they allow me to pursue it in the way that I think is most appropriate and helpful. So my process has been just based on what I've been hearing from folks for years and haven't seen enough in-depth coverage on.
Thank you. It's really helpful to kind of think about how we should approach this coverage from a more in-depth perspective, and be approaching it with a broader framework, and be approaching it from a public health perspective. And we very often are viewing these things through a journalistic lens. And since we have a trauma surgeon here, I'm curious, Eleanor, from your perspective as a non-journalist, but as someone who is seeing gun violence up close in a medical setting, what do journalists really need to know from your perspective? What are some concrete things that you think journalists are missing, or that they are just not paying attention to, or kind of, I'd love to hear your perspective on this.
Yeah. Yeah, I mean, and I think most of what I can say is to agree with what's been said already. And I feel a little bit of a tension between getting the numbers right and getting the context right. But you all are smarter than I am about this, and I'm sure there's a way to do it. So, you know, in the paper that I mentioned, it's kind of all about the numbers. It's like we don't even know how often these things are happening. So how can we even appreciate the extent? But on the other hand, I've kind of come to believe that the episodic reporting, and some of it is very episodic. It's, you know, 29-year-old male shot on West Market Street, and that's it. I don't know that helps anyone. I think it probably, you know, foments fear more than anything else. I think it's fairly dehumanizing to the person who's involved, and it doesn't tell us anything about the context, the impact, or what we could do about it. And I think all of those three things are the things that are missing. And, you know, I think a lot about you know, some of what Nasim and Abené just talked about the impact on people, the individuals who are injured, their peers who witness or live in fear of similar things, their families who are affected either by the loss of a life or the injuries that someone sustained, about the physical, the mental and emotional, the social recovery that's so challenging for so many of my patients. And we have started to see, I think, more reporting on that stuff. but I think more and more and more and more is needed, because I don't think we understand the, the depth. As a colleague of mine, Dr. Punch, says, bullets go deep. And I don't think we know that. And I think, I think what I want for people to understand how serious this issue is and understand how preventable this issue is. And so not that you're going to write, not that every story you're going to write is going to be like able to tie an event back to a specific policy or a specific program. But I think the opportunities for preventing gun violence are enormous. We don't have all the evidence we should have, but we know a lot. And the more we can bring that into people's minds, the better. I wanted to pick up on something that you said a while ago and ask you guys a question, if that's all right. Because we're talking mainly about interpersonal gun violence and community gun violence, someone who is shot by someone else who they may know or they may not know, right? The majority of firearm injuries in this country probably are community violence. The majority of deaths are suicides, right? And not everyone knows that. And that in itself is a fact that's worth knowing. 60% of firearm deaths are suicide. And the demographics and the risk factors are not the same as for community violence. So community violence disproportionately affects young Black men and other young people of color. Suicide disproportionately affects, has rising rates in those same groups, but also disproportionately affects older white men. So, but what they do share, one of the things that they share in common is that, that there's root causes and that there's lethal means, and that when those come together, people are hurt and people are killed. I know that there's quite a bit of thought that's gone into how to report and how not to report on suicide. But I wonder if we've gone too far in terms of not talking about suicide when we talk about firearms, and not, I know that we don't want to promote copycat suicides, and that there's standards for that you all understand better than I do. But is there a way that we can bring that back that's helpful, but that's not harmful, in terms of reminding people that this is also a preventable problem? 90% of people who attempt suicide with a firearm will die. 90% of people who attempt suicide and survive will not go on to die from suicide later. We'll get a second chance and we'll take advantage of it. So the means really matter. And I don't know if there's a way to bring that back. So I said a lot and I'm going to stop, but I wanted to get that question for the echo.
Yeah, I'm curious, Naseem or Abené, I'm curious if you have thoughts on that.
Yeah, I think over time, we have gotten a lot better with the language we use, definitely in the media, avoiding the word committing and saying die by suicide and phrasing like that. But I think, one of the challenges in reporting on suicide too is finding the information from families and sources, because, it's a private matter. So it's not, sometimes we just don't have access to that information to report on. But also, I think it's being aware that if we are reporting on a case, being cautious on what to report, how to, not getting into details of what's happening, but also providing information on how to prevent and what are the measures people can get, what are the resources people have access to. It is a difficult topic, and I understand what you're saying, and I don't know if I have the answer for it, but I'm going to drop a link in here where there's some good tips on how to report on suicide.
Thank you. I did want to circle back as well on one of the topics that was brought up a little bit earlier about mass shootings, which I think is very often on people's minds when we do talk about the subject of gun violence. So generally, there's no real official definition of mass shootings, but generally, defined as an incident where 4 or more people are hit with gunfire. I think, Abené, you differentiated between high-profile mass shootings. We know that mass shootings account for a small fraction of all gun murders that occur nationwide each year, but even so, they're far more likely to be covered in the media. We've all seen the small town that gets completely overrun by news trucks. And I'm curious, in a perfect world, if you were able to set industry-wide guidelines for how we kind of overhaul our reporting on mass shootings, what needs to happen there? What needs to change specifically, do you think?
That is a really good question. I mean, I think of course, when reporters go into, like you said, the small town that becomes overrun, one of my colleagues who covered Uvalde, she went and instead of doing a story like, I found this family, here's the kind of sad, my child was all this, that, and the third story, she did one about like, the news trucks are here, like this place has been completely overrun. And I think that stories like that can really be illuminating and helpful and are just as valuable to that kind of breaking news cycle as ones that, are very focused on the victims, and the families and the devastation and this is happening all over again conversations that we are always likely to see. So I think the coverage of the dissension upon some of these towns that might have had serious issues with gun violence previously, who might have been asking for years for, support and things like that and haven't gotten it. I think that those stories are always really interesting. I think just, the way we approach people. I went to a vigil after there was a high profile mass shooting in San Jose. 10 people, I believe, were killed at a transportation facility. And, I will say that I saw all the reporters there being very respectful in that space. When it was time for a vigil, folks stood around and the quotes they could get before, they said, if you would like to share, gave people plenty of room, at least from what I saw in the interactions I had, gave people plenty of room to say no, and if they said no, I had a situation where I asked someone, that he was standing in a group of folks wearing a t-shirt with the people who were killed. And I walked up and was like, hey, would you like to share anything about these folks, or is there anything you want to talk about? And he said no. And I asked, I was like, well, would it be okay if I just, took a picture of y'all? And that they were okay with, So I think that reporters putting their kind of awkwardness and discomfort to the side for a minute and not showing up like a nervous kind of shaky reporter, which is very difficult because this is a sad situation and you are human. And after I had to take a day off after I was in there, crying. And it was tough to try to slack quotes to somebody while you are also tearing up. But it's like, that's just what happened and I'm not going to hide it. But when I need to go and talk to people, I lead with like sensitivity and a level of like calm and steadiness that, that has so far yielded benefits, at least in that situation. So, I mean, when it comes to industry guidelines, I think the way we talk about most high profile mass shootings meet that numerical standard. I don't see a lot of like huge coverage of mass shootings where there is like 4 people just injured, unless it's like at a state house or something, or that kind of hierarchy of location comes into play. So I think that when it comes to high profile mass shootings, like an industry standard, I think that could be helpful is how we approach people who have either lost someone or have, or are just in the community where it happened. I think going to someone's like representative, or maybe not going directly to the family member, going maybe to like an aunt who was there and not necessarily the mom, like those sort of things, I think can get the job done and not put people in a situation where you're compounding trauma on them. But I think there was already a link to the Better Gun Violence Reporting organization in Philadelphia. And I know they have some really excellent resources. And I'm always curious about, how the people who are sent there, right? It's not their choice as a reporter, whether or not sometimes you're going to cover this high profile mass shooting. So I'm always curious about people who like are required to go there, and have to ask folks and have these sort of obligations. Like, I never want to be dismissive of those pressures, because I have kind of the privilege of talking to people after things have settled and talking to them about the news coverage and kind of, you know, rehashing things in that way rather than just in the moment. So I always like to be careful to not tell people how to do their jobs when they're in like pretty unimaginable situations as reporters and humans. So sorry if that wasn't like the most amazing or elegant answer, but
no, so helpful. Thank you. We are going to go to questions in a bit, so I just want to remind people that if you do have a question, please drop it in the Q&A, and we will go to questions in a bit. But I want to kind of build on what you were saying, Abené, and talking about kind of being trauma informed when interacting with survivors of gun violence. All of you interact with trauma survivors in the work that you do. And so I am curious your own best practices for working with people who have experienced violence, either themselves or in their communities. What does it look like from your perspective to be trauma informed?
So I will say I'm not very good at this, and I definitely have a lot to learn in this space. I think, you know, the basic thing is that what we experience influences how we react, and that's not pathological, that's not wrong, that's not bad, that's how people are, and that's how people should be, and that when you're speaking with anyone, that they bring their experience to the table. But particularly when you're speaking with someone after a notably traumatic event, that they are going to be shaken up, that they may not react the way that you expect, and that's not, you know, that's not a flaw. I think probably, you know, as Abené was just saying, you have the option in journalism, and individuals have the option of not talking to you. For me, a lot of times people sort of have to talk to me. They don't have to tell me anything specific, but if they're coming to me for care, they're a little bit stuck with me. And I am required to do extremely invasive things to them to try to protect their health. But I think there's probably some shared principles between us of doing our best to explain why we're asking what we're asking, why we're doing what we're doing, what we're going to do before we do it. That's something we talk a lot about in healthcare, but I think there's probably a journalistic correlate of, you know, these are the things that I'm going to ask you. This is why I think they're important. You know, if you don't want to answer, these are your options, sort of thing. And I think there's probably an opportunity to not necessarily understand immediately what someone's going through, but to validate that they may be having a normal reaction to a situation that none of us should have to consider normal. And that's sort of a tension that I try to bring to talking with my patients. None of this should have happened to you. You might experience all these different forms of stress. And when I'm talking with my team, you know, our patients do get angry with us at times, right? They do get worried, they do get agitated, they do get afraid, and they express those things in all kinds of different ways. And we need to find ways of welcoming those expressions, of supporting those expressions, of trying to understand where people are coming from and not dismissing them. I think there's probably some correlates to how you interact with people out in the world as well.
That's helpful. And Naseem, as someone who also works really closely in this space of trauma-informed journalism, I'm curious if you have anything to add here.
Yeah, I mean, the more I learn about it, the more I really wish that learning about how trauma affects people, like especially survivors, at the beginning, over time, and how to report on it would be part of journalism training and discussions in every newsroom, because I think it will make all of us journalists better reporters. And, you know, some of the main things that stood out to me as I learned about these things, and I wished I knew when I was covering tragedies, is like recognize that people who have been affected by traumatic event, you know, lost control in that moment. So the one thing you can do is give them control. And those are by little things like, you know, the question, as Abené mentioned, are you willing to talk to me and take a no for an answer? The thing you can do, you can leave your card with them. and tell them, I'm always available if you want to reach out to me. But also with questions, if you guys agree to meet, where would you want to meet? Where are you comfortable to meet? If they need to pause during your interview, give them that permission. And also for yourself, Abené, you said you were crying and it made me very sad. And Dr. Kaufman, I'm sure you see a lot of awful tragedies too, is to prepare yourself for the interview you're going in, understand what could affect you. So you at least go in with a little bit of shield. And if you need to take a break during the interview, if you can't take a long break, maybe have a sip of water, take a deep breath, those little things that allow you to get through the interview. And afterward, please take a break. Don't go straight back to your newsroom and start typing the story up. Take, half hour, an hour break. If you can take the afternoon off, take a break, let your body unwind, and then get back to this difficult story. And another thing with survivors that's very important, it's sort of all the rules that we know about interviewing, politicians and public figures kind of go out the door. And remember that a lot of these people are community members who don't typically deal with the media. They don't know our typical words of off the record, on the record, on background, things like that. So err on the side of over-explaining and obtaining informed consent. This is who I am. This is who I work for. This is where the story is going to come out. These are the people who are going to see the story. The story is going to be online forever. And information as if these are the terms that this is what off the record means. This is what on the background means. If you don't tell me everything you tell me is on the record, and I'm able to use that in the story. So, and also tell them if I ask you a question and you don't feel comfortable answering it, let me know, and that's okay. When you start the interview, ask them, where do you want to start? Instead of, in our brain, we want everything to go chronologically, beginning, middle, and end, but see where your source wants to start the story from. So all these little things you can do not only helps your sources, but also help you as a journalist to know you did the conscious and ethical thing. And not only you protected your source, but also you protected yourself.
Great, thank you. I want to make sure that we get to the questions that have come in. So this is a question from Ellen, who wonders, have you given thought to how vocabulary used in reporting gun violence could minimize the polarization between the pro-gun and pro-gun control audiences? Are there certain trigger words that should be avoided to minimize or help break down that polarization? If anyone has thoughts on that.
I have some thoughts sort of more, I'm again, still not a journalist, but when I'm doing policy advocacy, when I'm, working on research and trying to present this kind of thing, I think there are some signals that will make people, if people are inclined to think you don't know what you're talking about, may encourage that. So in most situations, I talk about firearm injury. And I talk about firearms instead of guns. I think that can vary kind of depending on your context as far as what's colloquial. Some of the terms, there are some terms that have some colloquial meaning, but don't have a technical meaning. So assault rifle is sort of not a thing. You might talk about long guns versus handguns. You might talk about high capacity magazines or high velocity rifles. But an assault rifle is sort of not a thing. And people who are very focused on, I would say, the firearm owner's rights side of things will be turned off by that type of language. I think, in more general terms, I think the more specific you are, the more human you are, right? The more you're going to reach people. That's certainly true in my work as much as it is in yours, I hope.
Yeah, I have found that if there's, one thing that has happened for me, like if a 18 or 19-year-old is killed, I've heard a lot of consternation about them being described as like a man, and they're not a boy or a child, but I just say teenager, you know what I'm saying? It's factual. it shows that this person is not, for all intents and purposes, a full adult. You know what I'm saying? That this was a life that was cut short at teenagehood. And I think it serves to not, infantilize anyone or anything like that, but is also a way not to like adultify, anybody, which we know is a huge problem, especially when we're talking about Black and Latino young folks, the boys and women, and the boys and teenage girls who are out here most likely to be shot by, honestly, like a peer or somebody in their community. I don't see the value of describing them as a man, or anything like that. I definitely agree with Dr. Kaufman when it comes to like calling things assault rifles, or in my coverage, I do quite a bit of work on ghost guns. And if I describe, the part of a ghost gun, like it's not the entire kit, it's a very specific frame and receiver and all of these terms that like, I'll put them all in my copy. And if my editor, finds them to be too wonky, we'll talk about the best way to make it accurate without getting rid of any of their, kind of lethal or legal ramifications. And that has served to really, I think, bring more people into the gun violence coverage. I don't get a lot of responses from like Second Amendment folks, gun owners, right-wing people that is like, you're trying to take all of our guns and you're doing all of these horrible things. You're horrifically underinformed and all that, because I focus so much on people that there's not really that room to talk about where I stand on like, gun control, which is another important term that a lot of people call it like the gun violence prevention efforts, right? Like to add gun restrictions and to add gun legislation. And I think that those, like staying away from colloquialisms and calling something a handgun specifically, or a long gun if it's not, will really serve to make that kind of coverage more credible for all of the audiences. And when I talk about communities, like, I haven't seen, if there's a place that has a lot of gun violence, I'll usually describe it as being like underserved, you know what I'm saying? Because if there's gun violence, and that means that there's not a lot of probably, property tax money going into the school, so they rely more on the state. There might be a lot of like low income students and, a lot of blight and these things that we see when an area has been underinvested in. So rather than calling it like a high crime or crime prone area, it's been underinvested in. It has a lack of resources. It's a place where students read below grade level. So there's just so many other ways to talk about these areas that are precise and illuminating, and also show that like, yeah, it's a place that's struggling without adding any stereotypes that end up being very racial, honestly. A lot of this comes back to like race and income, and anything I can do to be precise without falling into that, I certainly will do when it comes to descriptions of places and the guns and firearms that are used.
Yeah, I think I just would second and third that high crime. I never want to see the phrase high crime area. I never want to see the phrase dangerous neighborhood, because we're talking about people who live in places. And if it's the neighborhood is dangerous, we as a society have made it that way through exactly the mechanisms that Abené just talked about. And I want to also second what you said about gun control. I do a fair amount of research and work on sort of firearm policy, and firearm policy is often what I say. I don't think gun control is a productive term, and I don't think it's an accurate term. Similarly, talk about firearm safety when it's appropriate, firearm responsibility when it's appropriate, firearm security when it's appropriate. Those are all, I think, sort of useful terms, particularly when you're looking to work with people who do have and value firearms.
We also have a question here from one of our journalism faculty, wondering what you think about the demand for some journalists to release and publicize the videos or the images of carnage in the aftermath of a mass shooting. This is a big debate about should more graphic images be published. What are your thoughts on that?
One of my colleagues, actually, Clark Merrifield, and I'm going to share the link up to his story, did a in-depth look at this after Uvalde, because afterward there was all sorts of discussion. Release the images, don't release the images, and really there is no clear answer based on the discussions he had. But he says that there are two main themes that kind of comes out from discussion from people is One of them is like, what would those images depict? And the other is what kind of connection that news outlet has with the community. So these were the two themes that came from the conversation he had about with half a dozen people. So I don't know if you have a clear answer. In many instances, I know people say show the carnage. I don't think the media has access to those images really from, the awful scenes of the shooting. So it's not like that the media is not releasing it. A lot of times it's not released to the media, but assuming that they were available, I don't know if we have a clear answer to that.
Yeah, I think Naseem put it really well when she just kind of talked about there not being a clear answer and having to wonder like, how many questions we would need to ask before there was some sort of policy that was like, yes, in these situations we release the video. It's like, how ethically was it obtained? Like you're a news director and one of your reporters comes to you and just says, I have this horrific footage, the ethical ramifications are something that really need to be weighed out, and the connection that the reporter or whomever has to the community is going to be paramount. I got to, I paid attention to those conversations, and a lot of people brought up like Emmett Till's mother, you know what I'm saying, as kind of an example of like how seeing this horrific image changed everyone's, quote unquote, changed everyone's mind about this thing. But how many times have we seen videos of like, unfortunately, people being shot and killed by police? There are videos of people being shot and attacked in all types of places. So it would just really make me wonder, and I would really be interested in the conversations about the value of this and why we're doing it, is just knowing that this happened, not shocking enough, and what will that do to reporters and people? I just, I really appreciate what Naseem said there, and it brought a lot of questions to my own mind, and hopefully to the, the minds of the folks that are watching this right now.
So we're in our last couple of minutes here. So quickly, I just kind of wanted to end on something that Naseem had brought up a little bit before about the mental and emotional ramifications that come from covering traumatic events. And I'm just kind of curious if you have some quick thoughts on when you are working with trauma on some level in your daily professional life. What do you do to keep yourself mentally healthy?
Yeah, I've learned a lot of these tips from folks at DART, Center for Journalism and Trauma. And if you are not familiar with it, I highly suggest you bookmark it, you refer to it. They have a great style guide for trauma-informed reporting and a lot of other information for journalists. But one of the simple things you can do, it's called self-care. And I know we talk about it, we hear it a lot. It's, simple things like exercising, drinking your water, trying to get sleep. But what is the trick to it is that you have to be intentional about it. So try to carve out some time for those things that are good for you, whether it's 30 minutes of walking or exercising. Give yourself breaks. There are studies out there that even like tiny little breaks help with your mental well-being. So get up from your desk, walk around. After difficult stories, give yourself longer breaks. Ask your editors if you can have a couple of days off, if you can take a vacation, if that's possible, to unwind and relax a little bit from the difficult story you've just covered. As I talked about, prepare yourself for difficult stories and check on your colleagues. I know these days we are not in the newsroom, so try to keep in touch with your colleagues. That not only helps you build a network, which is like support network, so important. Having good relationships is so important, but also check on each other. How are you doing? What's going on? If you're an editor, the simple thing you can do instead of, you don't have to have a, complicated mental health conversation with your reporters, but say, hey, that was a difficult story. How did it go? Just having these simple conversations will help the other person talk it out. Watch out for signs of burnout, which is, you're anxious, agitated, maybe apathetic towards stuff, just don't care. Or you can't sleep, you're turning into drugs and alcohol. Those are all little signs of, so know when your cup is running empty. And if you need to seek help, I know therapy can be expensive, but if you have that option, even for 1 or 2 sessions, could be a big help to you. So don't discount that.
We unfortunately are out of time for our session today. I apologize that we were not able to get to every question, but I really, on behalf of everyone at the College of Communication, want to thank our panelists, Naseem Miller, Abené Clayton, Dr. Eleanor Kaufman. This was a really enlightening hour. I think we all learned a lot and really appreciate your perspectives. We really appreciate you being here. So thank you so much for joining us. Thank you to everyone who tuned in to watch this conversation. Our next Com Talk is Tuesday, October 4th at 3 p.m. It's titled Why PR Has the Ear of C-Suite Leaders. You can register on Com's event page, and we hope to see you at a future Com Talk. But thank you again so much to our panel, and we hope to see everyone soon.
Thank you so much.
Thank you.